All right, thanks everybody for coming. I appreciate you for showing up, and hi people on computer land for showing up too. So if you don't know who I am, my name is Dr. Boynton. This is my practice, Sycamore Chiropractic and Nutrition, and today we're talking about fertility or diabetes. Sorry, I get confused sometimes. So we have a lot of information to share tonight. I hope most of it's going to be valuable to you. Dr. Luke is going to come up here in just a minute and kind of talk about how chiropractic care can fit into treating diabetes and hypoglycemia or dysglycemia. So this is what you're going to hopefully learn today. How can chiropractic care adjustments help diabetes? You are not a victim to your diagnosis. The physiological web of diabetes, hypoglycemia versus hyperglycemia. What is metabolic syndrome? What is type 3 diabetes? We're going to talk about some lab testing, and we're going to talk about some nutraceuticals or supplements that can help with this stuff. So for all of you who have Medicare, this is what Medicare thinks of you.
Thank you for coming.
Care that seeks to prevent disease, promote health, prolong and enhance the quality of life is not considered medically necessary. Isn't that nice? We don't want to promote you to be healthy. We don't want to prevent disease because that's not medically necessary to keep old people well. Thanks, U.S. government. You're the best. I thought that. I came across that. I'm like, really? I'm like, that's in print somewhere? Yeah, that's the Medicare rule number right there. You know, 2251. That means they have lots of rules and things that they want to talk that they cover. So next, Dr. Lewis can talk about how chiropractic care has anything to do with diabetes and things like that. Dr. Luke Al.
All right, nice. Good to see you guys. Again, I'm Dr. Luke. So my part will be very short, and we're just going to look at kind of two aspects. We're going to look at more of a neurological aspect, and then we're going to look at kind of joints and arthritis. So the first thing neurologically aspect-wise, so there's two things we're going to look at with innervating the pancreas, which is huge with blood sugar, as you guys will go in more detail with Dr. Boynton, is more the controlling it to kind of put brakes on it is going to be in your T7 to T10 area, the sympathetic, that's kind of what can shut down the pancreas and cause it to kind of calm down. So chiropractically, if we are having issues where those nerves are not getting to the pancreas, then we're not getting the brake system. So that might be overworking it. It might be sending too much secretions out, and that can affect that as well. And then parasympathetic wise, which is over here with the vagus nerve, that's usually where we see more of that. That's going to help stimulate it and get it kind of working and moving more. And so that's where we do a lot more with chiropractic usually. Patients that it's not sending out enough insulin, it's not regulating as well. The more we can work that vagus nerve all the way up to the top, helping calm down the body. So that's where we're going to look at the two aspects neurologically with chiropractic care. Does that make sense? Okay. The second thing is looking at kind of arthritis and more like pain management. So with blood sugar diabetes issues, one of the main things that can happen is a lot of times tightness in the hands. And so it's going to be a lot of stuff with the farthest away extremity blood and neurological going to those areas. So one of the first signs people get like is like tightness in the hands. So chiropractically, we're working, moving that, keeping it growing, keeping it moving, so that you can do your things. Obviously, you lose grip in your hands, you won't be able to do as much stuff. So that's going to be one of the main things. Now, with your feet over there, with the beautiful pictures of these great feet over here, that's called Charcot's joints. What happens with that is, for our progression of diabetes and blood sugar issues, your nerves stop working in the distal areas. So if you're not going to feel this foot, it can start to break and get injured without you knowing it. You don't feel the pain, so then you can keep walking around it and it can get really ballooned up. And so that's kind of something that we're trying to prevent this by making sure all your nerves are working, everything else is managed with stuff for Dr. Boynton. We're talking about trying to kind of avoid this late stage progression. So in the early stage, we're trying to keep everything moving and making sure we're avoiding that. Now there's two types of arthritises that are associated, one with type 1, one more with type 2. Type 1 is going to be more the rheumatoid arthritis. That's that correlation with the autoimmune aspect of it. And so you can have, attacking different joints. Chiropractic is not going to do as much with rheumatoid. We can kind of help manage some of the pain, working with that. The second one with type 2, which is more common, is going to be osteoarthritis. That's going to be extra weight, extra wear and tear. So chiropractic wise, the more we can get better alignment, more equal wear and tear, then we can have less of that effect with osteoarthritis. And so those are kind of the different aspects of how it's going to be affecting neurologically, stimulating different aspects and different nerves, and then also looking at the joints and how we can keep everything moving. Any questions kind of with that aspects of the two things before we turn it over to Dr. Boynton with all the functional medicine?
So I have a personal connection with diabetes, not that I have it, but my grandmother did, which I didn't understand when I was a little boy. But she had type 2 diabetes, she had earned that, and she had neuropathy in her feet. So she couldn't feel her feet. She got one of her feet infected. It turned gangrene, and they had to cut her feet off. And they said, well, in order to do that, we have to give you a huge infusion of blood because you're going to lose a lot of blood, and that might kill you, or the complications afterwards might kill you. So she didn't make it. She's in heaven with Jesus right now, thank God. So I kind of have a personal vendetta against diabetes, against chemical companies, because they are big promoters of diabetes. We'll talk about that as time goes on, but this is something you can control, and you are not a victim to a diabetic diagnosis. We've helped hundreds of patients no longer have diabetes, get off diabetes medications. Now, a lot of endocrinologists are going to disagree with me and say, once you have diabetes, you will always have it. And I say, that's not true. In their world, that may be true. But if your blood sugar is below 100 consistently, not on medication, and your A1C is below 5.6, you are no longer pre-diabetic. And if you say that without medication, aren't you cured? Aren't you managed? I don't care what you call it, but you can, and your body will heal given the right opportunity. So that's what we're going to talk about tonight. So you are not a victim to your diagnosis. Metformin and statins, I think, doesn't everybody just need that? I mean, you can go and buy that everywhere. If you're past a certain age, they just want to dole it out to everybody because they think that's the solution. The solution is to be responsible, not to eat whatever you want and eat more crap. Oh, I'll just have a bowl of ice cream and I'll just give myself some diabetes afterwards, or some insulin afterwards. That'll be okay. I'm like, really? That's what my doctor told me to do? So eat whatever you want and then control it with insulin after the fact? That's not really okay. Like, that's promoting disease. It's like a drug dealer. Hey, this one's free. You gotta pay for the next one. That's not okay. You know, is it my genes? Is it genetic? Well, everybody in my family has diabetes. Well, if everyone in your family eats like crap, guess what? And you eat like crap, you're gonna get diabetes. Now, there are obesogens that we're gonna talk about later, so there is some genetic part, but it's not handed down from your family. If you do what your family did and live their same lifestyle, you will most likely have the same conditions they had. Genes only have about a 4% role in all health problems, including cancer, 4%. Everything else is lifestyle and toxins. We're talking about that. Is it your fault? Sometimes it is, sometimes not, but it is good news because we can control and fix this. So dysglycemia. So what is that? That's just blood sugar imbalances. So this is kind of what a normal blood sugar pattern looks like. You kind of wake up in the morning, it's low, and it kind of goes up and down throughout the day based on your meals. So what happens when you have hypoglycemia, it really crashes down low, and hyperglycemia, which is diabetes, really crashes up high. And that's not what the slide's supposed to look like, so we're just gonna move on. So how do you know if you have dysglycemia? So dysglycemia is just blood sugar imbalances, abnormalities in blood sugar. So it's gonna be high. Hyperinsulinemia is diabetes, hypo is low blood sugar. So you get hangry when you're like that. So normal blood sugar response. So you wake up, you have plenty of energy, and you feel rested. You're actually hungry when you wake up in the morning. You don't really get hungry between meals, and you have no fatigue or change after you eat meals. So one of the first questions I ask my patients is, how do you feel after you eat? That talks a lot about how your body responds to food. So functional hypoglycemia. So you struggle waking up in the morning, you don't have an appetite, you drink sugar or coffee to get you going, you fall apart, you get hangry between meals, food actually causes you to have energy, you crash between 3 and 5, you crave sugar, salt, caffeine, and you have a difficult time staying asleep or falling asleep. That's kind of hypoglycemia. That's your low blood sugar people. Those are typically your skinny folks. Insulin resistance, you wake up tired. You might wake up in pain. You need sugar. You have a lot of sugar cravings. You have a lot of starchy foods because that kind of fills you up and keeps you going. You crave sugar all day long. You're tired after you eat. You crash after lunches. You need stimulants, so you're craving that chocolate and that sugar and the coffee after a meal, and you have difficulty falling asleep. So after you eat, you should feel full. That is the appropriate response. You shouldn't feel tired. That means you ate too much. You ate too many carbohydrates or not enough fat and protein. And if you feel energized, that means you were going into that meal with low blood sugar. So those are some simple things you can kind of recognize in yourself, these patterns. Now, if you occasionally eat too many carbs and you feel tired after lunch, not a big deal. If sometimes you go into a meal and feel energized afterwards, that's okay. This is on a consistent basis that you feel this way. So that is not normal to get energy from food, and it is not normal to feel tired after a meal. So if that's consistently your problem, we need to talk. So if you've seen any of my presentations in the past, we'd like to talk about the physiological web. So what string can we pull on to impact all of them? So sometimes you fix one physiological problem or breakdown and it fixes 17 things, and now you gotta fix the other 2. And sometimes you can have 17 different problems. So this is the physiological web of hypoglycemia, so low blood sugar. So when you have low blood sugar, nocturnal hypoglycemia, if you can't go 3 or 4 hours without feeling hangry, most people wake up in the middle of the night and they can't fall back asleep because their blood sugar is so low. So if you eat dinner at 6 or 7 o'clock, by 2 a.m. you've gone hours and hours without blood sugar. Your blood sugar is bottoming out, and you wake up and you can't fall back asleep and you just lay there. That's because your brain needs sugar. If you can't fall asleep, it's because you have too much sugar in your system and you're ramped up. So these are all things that are common to happen with hypoglycemia. So this is when these systems are broke, the systems are wrong. You can get anxiety. Your frontal lobe needs sugar more than any part of your brain. So when you have hypoglycemia, your frontal lobe's not getting adequate levels of sugar. So you're gonna have difficult time with executive function, like planning, your working memory. What am I doing? What am I supposed to do next? Organizing things. So when your blood sugar goes up, hyperglycemia, your brain doesn't work well, it gets inflamed, and when it goes low, it doesn't work well. You want to have that Goldilocks blood sugar that kind of stays just fluctuating by 10 or 20 points throughout the day. So these are all the breakdowns. You're exhausted. You crave sugar because you need energy. You crave salt to help out with your blood pressure. You might get swelling. Cold hands and cold feet are common. Hair falling out, depression, anxiety, irritability, poor brain endurance. If you get fatigued just from reading, that's not common. You're exceeding your metabolic mitochondrial capacity of your brain. So when your sugars are all over the place, your brain is not going to be happy. So blood sugar is way more important than it is for your brain. A lot of times I tell my patients, I need you to eat for your brain, not for your stomach. They tell me, I'm not hungry. I'm like, I don't care if you're not hungry. Eat a couple nuts, eat a small amount of food because your brain needs fuel. So when you get hangry, your blood sugar was low an hour before you noticed a symptom. So if hypoglycemia sounds like you, how many hours can you feel normal without having symptoms associated with hypoglycemia? And you need to eat an hour before that symptom occurs to make your brain happy. I don't care if you're not hungry, you need to eat for your brain. So these are some symptoms of having hypoglycemia. So fatigue between meals, crashes of energy in the mid-afternoon, typically it's between 3 and 4. You have some sugar cravings, you kind of want dessert maybe. So you have improved energy after eating a meal. You're irritable, shakiness, anxiety between meals, mental fatigue, mood swings, difficulty falling asleep, staying asleep. So if that sounds like you have some hypoglycemia. Hypo, the O means low, so that's how I remember it. So then there's also functional or reactive hypoglycemia. So this is what we talked about when your blood sugar drops. So these are some solutions. So what am I supposed to do? You're not eating meals, you're having snacks. So nuts and seeds, hard-boiled eggs, healthy meat sticks, like little tiny beef jerkies, a protein bar, some avocado, hummus, apples. So if you notice this, these are all foods that are high in fat, fiber, and protein. So when you combine fat, fiber, and protein, if you eat carbohydrates, your blood sugar goes up. The higher it goes up, the lower it goes down. Fat, fiber, and protein causes the glycemic load of your carbohydrates to do this. This is what we want. This is the Goldilocks blood sugar. Goes a little bit up, a little bit down, a little bit up, a little bit down. So it's also important, which I'll talk about later as well, the order in which you eat your food is also important. You want to eat your green stuff first. Your salads, your broccoli, your green vegetables, things like that. Why? Because that fiber is going to get into your GI tract first. That's going to lower the glycemic load in your bloodstream. Next, you eat your fat and protein. That's typically your animal meat. If you eat meat, so you want to do that. And that kind of fills you up. And now you get onto those starches and carbs. Well, one thing, you're kind of full, so you might tend to eat that baked potato. Instead of eating the whole thing, you might only eat part of it. You might only eat a little bit of the bread. You might only eat a little bit of the starchier foods, as opposed to starting off with the starchy foods first. Now your blood sugar is already going up. So the order in which you eat your food is important. So these are some diet and lifestyle mechanisms associated with hypoglycemia. So it's important that you do not miss your meals. So missing meals is going to be a big problem for you. Eating those sugary snacks, using a stimulant to get you going because your blood sugar is low. So you're reaching for that Coke. You're reaching for the cigarette potentially. You're not getting enough fat, fiber, and protein. You can overtrain really easily. So you're exhausted after a short amount of work because what's happening is when your blood sugar gets low, you have glycogen. That's sugar stored in your muscles. So when your blood sugar gets low, your body starts robbing your muscles of that sugar for fuel, and you can overtrain and injure yourself. So so those are also some things on the far side. So when you're feeling jittery, you're feeling shaky. So those are all common symptoms of having hypoglycemia. So what happens? So you have glucose, which goes down. Your pancreas robs your liver of glycogen. So now your adrenal glands kick in. Your adrenal glands are responsible for a stress response. Most people who have, this is kind of what Dr. Luke talked about, that sympathetic, parasympathetic state, when your blood sugar drops, your adrenal glands kick in, make cortisol to help you function. But the people who have hypoglycemia, or that low blood sugar, think about your adrenal glands as your backup system or your backup generator. When your blood sugar tanks, your backup generator produces energy with cortisol. If you have adrenal fatigue or adrenal exhaustion, you have no backup system. That's why we measure cortisol salivary testing with a lot of our patients to know, do you have a backup system, or have you been so exhausted you don't have any? You should be able to skip meals very easily and feel normal. And when you can't, we know there's a breakdown in your endocrine system and your adrenal glands. So you have loss of stress resiliency, which is basically what this is talking about here. So you're going to intake food to get glycogen, which is stored in your muscles. You have the inability to raise your blood sugar, so then your adrenal glands kick in. If they're insufficient, you don't feel well, which then hypersensitizes your receptor sites on your cells, and then your brain does not work. So we kind of have different levels of hypoglycemia. So maybe like a level 3 would be a functional hypoglycemic. You can function pretty well. I get hangry sometimes, not a big deal. Functional due to underlying metabolic disease. So these actually turn to diabetes. If you have low blood sugar your whole life, you have an increased risk of dementia and Alzheimer's and diabetes. So those lows, because you have basically desensitized your insulin receptor sites on your cells, your beta cells and your islets of Langerhans, and those cells, they're shot. So now your body doesn't receive insulin well and use it properly for brain function and for energy, and now you turn on type 2 diabetes just from having that. So this is the physiological web of too much blood sugar. This is your hyperinsulinemia or diabetes. This is what is the most common thing, one of the most common diseases in the entire world actually. Over 150 million people, even in the United States, have diabetes. So this is what happens when the blood sugar levels go up. So your hypothalamus is in your brain. That helps out with this satiety. Satiety. When you get full, that mechanism, your body produces leptin. So when you've abused that system, it doesn't produce leptin anymore. So then you just eat and eat and eat and eat until you cannot put food in your belly anymore. So then you get these huge insulin surges, which creates all kinds of inflammation in your brain. When your brain's inflamed, it does not work. So that can drive anxiety or depression because your brain is used to having that elevated blood sugar. So when it gets closer to normal, depression, anxiety kick in. So their Goldilocks is way up here, and it shouldn't be. Their brain's used to working on high levels of glucose, of sugar and insulin. So when you pull that away from them, they don't do well. That creates inflammation. That creates intestinal permeability. That creates leaky gut. Leaky gut turns into endotoxemia, which causes a breach in your blood-brain barrier, which increases your risk of type 3 diabetes, which is dementia and Alzheimer's, which causes dysbiosis, which messes up your testosterone and estrogen levels. This increases your risk of cancer. Then we come here, the cortisol response. That's your ability to function under stress. It increases your acidosis in your body, which turns on glycation, which is critical damage, which is oxidative stress, which is what they measure when they look at hemoglobin A1C. So what can we do to pull on this web to make all this better? So anybody ever seen this before? Almost looks like you didn't wash your like the creases in your body. This amyloidosis nigricans is a common thing that we see people have before the onset of diabetes. It looks like, man, like, do they get like dust in the creases of your elbows or on your hands or your neck? This is a precursor to diabetes. So if you see this means the insulin in your body has been high for a long time, and it starts to impact your skin. It's easier to see on Caucasians than it is on African American people, but it'll kind of show up in your armpits, on the crease of your neck, on your knuckles. They'll be discolored. Your knees, the back creases of your legs. So that's an early sign of having that. So hyperglycemia, diabetes. So you're gonna have fatigue after meals because you've exceeded your carbohydrate intake for that short period of time. You have impaired brain function, carb coma. Why do you get tired? Because your brain is so inflamed. Think about a computer. When a computer gets overheated, what does it do? It shuts down. When your brain gets overheated from too much inflammation from sugar, what does your brain do? It shuts down. That's carb coma. You've pissed off your brain because of the consumption of carbohydrates. Chronic inflammation throughout the day. Your joints hurt, kind of what Dr. Luke alluded to. You have to go to the bathroom a lot, and you have difficulty exercising due to lack of motivation, and you have poor energy, and your joints hurt. And you're probably carrying some extra pounds, which makes your joints hurt too. Those are some signs of that. So insulin resistance, the physiological web. So this is kind of what takes place in the GI tract. So glycated hemoglobin. This is a common marker that we lose, hemoglobin A1C. We probably all heard of that before. It's actually not a marker for diabetes. We kind of group it in that, but it's glycolated hemoglobin. Glycolated hemoglobin is due to oxidative stress. What is oxidative stress? Free radical damage. What is free radical damage? If you cut an apple in half, what happens to it? It turns brown. It oxidizes. What happens if you put a piece of metal outside? It rusts. That's oxidative stress. The cells in those substance ends are getting glycated. So they're oxidizing, they're rusting, they're creating inflammation. Blood sugar creates a lot of glycation in the body, which causes the breakdown and deterioration of the cells from blood sugar. Other things like toxins cause a lot of free radical damage. So this is what takes place. So this elevated blood sugar creates free radical damage, which causes glycolated hemoglobin, which damages your nerves, your blood vessels, and your kidneys. And as a result of that, you don't have energy. when you have insulin secretion, when that doesn't happen, you get systemic insulinemia, which suppresses lipolysis, the breakdown of body fat. So when your blood sugar is high, your body will not lose weight. Your body can't, it's almost physiologically impossible to lose weight. And then that turns on tumors, aromatase. Those are your endocrine related cancers. So this is kind of what happens in the body. So what are some mechanisms behind this from like a lifestyle standpoint? So lack of physical exercise, so you don't move. Overeating, because those leptin and ghrelin receptors in your brain are desensitized. You can eat until you're full up to here instead of being full when you should normally. You're gonna want to eat high carbohydrate, high sugar meals. You really like to socialize with people, and you socialize around eating, and you have lots of lack of fiber in your diet. Fiber is very, very important, both for hypoglycemia and hyperglycemia, and we'll talk about that towards the end. You're often tired before meals. Man, I'm tired, I just need to eat some food, and I feel better. And that gets into that habit of eating snacks in between. And most people who have diabetes typically don't grab healthy snacks. You know, like the Snickers commercial. Man, you're getting hangry, you need a Snickers. That's what they grab, sweet things. Goes up, crashes again. Another snack, goes up, crashes again. Now they eat lunch. After lunch, they get carb coma. And then chief complaints of insulin resistance, fatigue, inability to lose weight, joint pain, depression, mood disorders, infertility, hair thinning, and hormone imbalances. So those are all common things that people have a lot of these symptoms and don't have diabetes yet. So we see a lot of people that have a lot of glycation, free radical damage on the inside, having these symptoms before their blood sugar even is impacted on laboratory findings. So this is kind of an example of what happens. The pancreas obviously produces insulin as a result to blood sugar. So your blood sugar exceeds your pancreas' ability to make insulin. So that all causes free radical damage inside your cells. So we kind of have a scale. So your blood sugar is elevated after you eat. Insulin resistance is kind of when your fasting glucose is between 100 and 126. Then that turns into metabolic syndrome, which we're talking about later, and that starts to impact your cholesterol levels. Then you get diabetes. Now you get diabetes above 7, and that starts to impact your brain. Your brain starts to get destroyed, and now you have neuropathy in your feet, in your hands. In type 3 diabetes, you can think of that as neuropathy of your brain, because your brain physically shrinks, and now you get dementia, Alzheimer's, and it can kind of turn on Parkinson's sometimes. So what are some symptoms of metabolic syndrome? So metabolic syndrome is a combination of several things. So you have a lot of fatigue after meals. You need to take a nap. You get that carb coma. You have weight gain. You can't lose weight. You have sugar cravings throughout the day. You have swelling in your joints and pain in your joints. Typically the larger joints and lower back pain, and your brain function sucks. And it's because you eat too many carbs. So typically it's high blood sugar, high blood pressure, and hyperlipidemia or high cholesterol. These are all things associated with that. And all that has to do with your liver, which is where glycolysis takes place. This is a common thing for men. So if you have a waist circumference greater than 40 inches, you have your low LDL cholesterol, you have high triglycerides, high glucose or high sugar, and high blood pressure. For women, it's 88 centimeters. Your LDL cholesterol is less than 50. Your triglycerides are greater than 150. Blood sugar greater than 130 or 110, and blood pressure greater than 130. So this is your typical white dude who had diabetes. Big belly that's rigid. That rigid belly, we kind of almost like you swallowed a basketball, is kind of the typical diabetes. It's not soft and squishy. It's more hard. So that increases risk of having a heart disease, high cholesterol, hypertension is high blood pressure, type 2 diabetes, dementia, cancer, PCOS happens to women, and non-alcoholic fatty liver. That's kind of the family of metabolic syndrome. So kind of what's a complication? So diabetic neuropathy, tingling in your feet. So you actually damage the nerves at the very end. Think of sugar as little tiny shards of glass. The more shards of glass you have in your blood, the more shards of glass get out and impact your skin, the joints, and the nerves. Diabetic retinopathy, that's how diabetes affects your eyes. Those shards of glass impact your eyeballs themselves and the nerves going to your eyes. Diabetic albuminuria or microalbuminuria, you have elevated protein that splashes because your kidneys have a difficult time filtering the sugar or the little shards of glass. You start kind of excreting too much protein through your urine. Dementia, so your brain turns to mashed potatoes, as I call it, jokingly, but that can be completely controlled through your diet and lifestyle, and it's what you do now in your 30s, 40s, and 50s, and maybe 60s that's going to impact your brain in your 70s, 80s, and 90s. Cardiovascular disease, stroke, peripheral artery disease, and then some pancreas, beta cell integrity, so you'll have elevated high or low C-peptide, hemoglobin A1C over 9, and diabetes for longer than 10 to 20 years. So those are all things associated with elevated A1C. So if we look at the chronic consumption of artificial sweeteners, oh, I won't use sugar, I'll use artificial sweeteners. That's gonna be a better option, right? That's what the commercials sell you, because they're trying to sell you and they're trying to make money off of you. So when people who have type 2 diabetes use that, it increases your risk of cancer by a lot. That's what that tells us. So this is how elevated and inflamed body fat impacts all these things. It causes sleep apnea, arteriosclerosis, which is hardening of your arteries, obesity, chronic pain, migraines, dyslipidemia is elevated cholesterol levels, diabetes, thrombosis, stroke, high blood pressure, your muscles atrophy and waste away, you get infertility, depression, inflammation. All bad things because your fat is inflamed and it causes inflammation. And a lot of toxins are also stored in your body fat too that we'll talk about at some point in time tonight. Type 3 diabetes, I've mentioned it a couple times. Have you guys heard of type 3 diabetes before?
Yeah.
It's not so much a medical term or diagnosis, it's what people, I really think it started in the functional medicine community. So type 1 diabetes, we're not going to talk much about that. That's an autoimmune condition. Type 2 diabetes is commonly thought to be because you've consumed too many carbohydrates over the course of your life. And type 3 diabetes is dementia and Alzheimer's. So your brain is super saturated with sugar for a long period of time. Your brain physically shrinks, you lose volume of your brain, and it commonly starts in your frontal lobe. So this is kind of what this talks about. It's kind of a coined term, probably within the past 10 years. So the longer you have type 2 diabetes, it increases your risk of type 3 diabetes, dementia and Alzheimer's, anywhere from 50 to 150%. That's a lot. I want to know who my grandkids are when I'm old. I don't want to be a nuisance or a problem for my children to take care of me. I want to go to sleep and not wake up and be with Jesus.
Amen.
I don't want to be in a assisted living, and they're building more and more and more of those because baby boomers are living longer with no quality of life, and that's not okay. So the cells in the brain get insulin resistant as well as the cells in your body. When your cells are insulin resistant, you have too much glucose in the blood, which creates inflammation. So chronic inflammation creates what we call tangles or plaquing in the artery, in the glial cells themselves. So this brain cell can't talk to this brain cell, can't talk to this brain cell because of plaquing, because of inflammation in the brain. And you actually get glucose toxicity in your brain. That's what dementia is. And it's from toxins and blood sugar and trauma. And what's the trauma from? Obviously physical trauma or stroke or TIA, hard plaque, soft plaque type things. This is a great book, The End to Alzheimer's. So this is Dr. Dale Bredesen. I learned a lot when I read this book. I recommend it to a lot of my patients. And one of my favorite things is some books, this is the problem. Okay, thanks. He says, this is the problem, this is what's the problem, and then this is what you do about it. After every single chapter, there's this is what the problem is, this is why you have the problem, and this is how you fix it. That's why it's a good book, because it gives you a solution to help fix this, and we're gonna talk about that after I kind of talk about these things. So if this is something that kind of runs in your family or something you're concerned about, it's a good book, 20, 30 bucks. It's not a hard read at all, and they have audio versions of it too if you don't like to read, like to listen to books. So what are some lifestyle things you can do to help correct your diabetes? So obviously reducing your glucose, the carbohydrates and the sugars in your diet, increasing your fat, protein, and fiber. Eat more vegetables, meat, lentils, and eat it in that order. Avoid fruits and sweeteners and starches. Eliminate caffeine or nicotine. Exercise, you have to move your body. Our bodies are designed to move, and you have to get enough sleep. Sleep is super important. That's when your body really heals. So if you're getting broken, interrupted sleep, your brain's not gonna work well, and you're gonna feel horrible, and you're gonna have more pain. Your brain won't work as well. So there's kind of 3 levels of hyperinsulinemia or diabetes. So level 1, you have to increase your fiber, reduce simple carbohydrates, and making sure that you're eating meals and you're not snacking at night. So doing this for a few weeks will start to reduce your sugar cravings. So remember, you're eating your vegetables, your protein, your carbs, kind of in that order, and you're trying to move a little bit. So kind of as we progress through this, now that we've done this, we can try to get and do some ketogenic diet stuff. Have you guys heard of the keto diet? It's kind of a high fat. It's really high fat, moderate protein, low carbs. So our body fat has 3,500 calories, which is a tremendous amount of calories that we have stored everywhere, mostly here in our bellies. So if we can turn on ketosis, we're really stoking that fire, so we start burning our own body fat for energy instead of carbohydrates. But you have to get fat adapted first. Sugar is a very simple fuel source for the body, and sometimes that takes weeks from your body to recognize that because we're getting so few carbohydrates, we have to start using our own body fat for energy. Once you get fat adapted, I've had patients that I went to bed and weighed this, I woke up and weighed this. I'm like, you lost 2 pounds sleeping? Yep, you lose weight sleeping. That's a good deal right there. Mm-hmm. But you have to get fat adapted first. So the first step is to really start increasing your fiber, increasing your fat consumption, and your protein. Next, we want to try to do some ketosis and high fiber diet, kind of level 3. Once you get that keto fat adapted and you're no longer hungry, start doing some intermittent fasting. And then the 4th level is intermittent fasting with ketosis and high fiber. You can't jump from that to that because you'll feel horrible. Your brain will get confused because it doesn't know how to get fuel. So this is the kind of sequence of how we kind of want to evolve people and have them move through modifying their diet. Because when you have diabetes, you're used to having way too much sugar. And taking that away, your brain does not like that. So we kind of have to do it in these steps. So this is the kind of first thing you start doing. So no sweets, no fruits, or maybe some blueberries and some berries. So you're consuming a lot less carbohydrates. You're eating lots of vegetables, no potatoes. You're consuming smaller portions. You're not eating at night, and you're trying to do some exercising to your capacity from a pain standpoint or a mobility standpoint. You don't want to exercise if you have a ton of pain, obviously, but there are things you can do. If it hurts to exercise, you can at least stretch. Stretching really is valuable if you can't exercise. So this is the first part of that. It's in the wrong order. So level 2. So this is kind of what that keto looks like. So you're gonna keep doing everything from level 1, and you're really gonna try to get 70% of your calories every day from fat, 25% from protein, and 5% carbs. So if you look at it, it's almost like an upside down pyramid. So what we see, that's kind of more the keto pyramid as opposed to the normal food pyramid. And it might take up to 3 to 8 weeks to kind of get from burning the carbs into burning fat and ketosis for diet. So kind of going from level 3, you're gonna do everything for level 1, everything for level 2, and then you're gonna start to try to do some intermittent fasting. What does intermittent fasting mean? Basically, you're skipping a meal. So you're gonna fast for anywhere from 16 to 18 hours, so it's food deprivation. The more meals you skip, the more days you fast, the longer you're actually adding days on the end of your life. I love to fast. My brain feels so happy when I fast. It's unbelievable. But not everybody can do that. Some people struggle if they miss a meal. They should never fast. And if you can fast, I really recommend that. So trying to do some intermittent fasting. Most commonly, people will skip breakfast. It's almost always kind of skipping breakfast or skipping dinner, and you can just skip breakfast one day a week. You could skip breakfast every day a week. You could skip dinner. It can change. Nothing is written in stone. But you want to start depriving your body of calories and nutrients, because most of us have lots of extra calories and nutrients stored in our body somewhere, typically in your belly. So that's kind of what you want to try to start doing, is thinking about those things. So you have to kind of figure out what works best for you. Maybe based on your schedule with your kids, you can't skip dinner, so you skip breakfast. But on the weekends, you can skip breakfast and have dinner, or vice versa, whatever makes the most sense for you. So you're trying to basically fast as long as you can. And there's all kinds of different fastings that you can look up. There's the 5-2 fasting, there's the eat, stop, eat, there's the alternate day fasting, the warrior diet, spontaneous meal fasting, multiple day fasting, fasting mimicking diet, and time restricted feeding. So those are all there's a million different kinds of fasts you can look up. Those are the most common ones. But those people who have low blood sugar should not fast, because your brain will hate you if you do that. Now to level 4. This is where you're really starting to burn out your body. You're fat adapted, you're feeling good, you're not hungry because fat keeps you full. If you're full, you just don't want to eat because your body's used to not having as much food in your belly, because you're getting all these calories and nutrients from your body fat. That's when you really start to lose a lot of that weight. So you're doing everything from level 1 and level 2 and level 3. And some people don't need to get to this. Now, a hardcore keto diet is not something you probably want to do for the rest of your life, unless you do it appropriately under doctor supervision, because when you eat nothing but fat, meat, and a little bit of carbohydrates, unless you're eating organ meat, you're going to get depleted of minerals. You're going to get some constipation, and you might get some muscle cramping. So that's not something for everybody. You want to find a doctor, probably a functional medicine doctor or a dietitian who really understands how to do a keto diet. And your blood work's also going to be off too. Your lipids are going to go up. So your doctor needs to not freak out because your cholesterol goes up because you're eating a dozen eggs a week. So there's a reason for it. If you're not doing keto and your cholesterol's high, then that might be a problem. So the most weight I've ever had a patient lose, he lost 100 pounds in 6 months. He was in ketosis in 3 days. I'm like, you got in ketosis in 3 days? I've never had a patient ever get in ketosis. He's like, yeah. He's like, I lose like 3 pounds a day, like doing nothing.
Wow.
Now that's uncommon, but that's realistic for some people. So it's pretty cool. But there are medical conditions that you should not do a keto diet. There are certain genetic conditions that you should not do a keto diet. So consult your doctor or kind of get on board with us and we can help you kind of navigate that, what that looks like. So you have to exercise, and the intensity of the exercise really impacts the load on insulin and weight loss, and your body's ability to burn fat. So basically, more is better. The hotter you can get your body by doing intense exercise, the longer you will burn energy for, the more weight you will lose. Now, what does intense exercise look like? Some people, it's walking 2 miles an hour. Some people, it's running a marathon. Most of us, it's somewhere in between. So exercise as intensely as you possibly can, at least 20 minutes, sometimes no more than 40, or at least 40 if you can, every day of the week, and you'll be surprised what kind of mechanisms you try on your body to help lose weight. So here's some so now we're talking about some lifestyle things. So for some hypoglycemia, so those low blood sugar patients, you want to reduce. So we talked about what the diabetic patients are going to do. This is what the hypoglycemia patients are going to do. So you're going to try to eliminate coffee and caffeine. You're going to avoid overtraining. You can really over-exercise. So if you feel exhausted after you exercised, you overtrained. You should have energy. When you don't have energy, you overdid it. That means you did it too intensely, for too long, or you went to exercise and didn't eat enough food. So those are things you want to kind of look out for. Making sure you get enough sleep. So don't get hangry, irritable, or brain fog. So once you know that you're kind of getting out of that hypoglycemic state, your food cravings will be gone. You'll not have symptoms of being energized after you eat, and you'll start to notice that you start to sleep through the night. And that's kind of some things that those are hangry people over there. So what is timeline for insulin resistance? So insulin resistance starts, you have these symptoms for 15 years, potentially. So I get a lot of patients come in who have these symptoms. I'm like, oh, you're on the train for diabetes. You're 20 and you have these things. I'm like, in my mind, I'm like, okay, we got to really start working on this or they're going to turn into diabetes. Once you have diabetes for 10 to 20 years, that's when all the bad stuff happens. Dementia, cardiovascular disease, and stroke. So the longer you have diabetes, the longer you have elevated A1C, the higher chances you have of having dementia. So this is the physiological web, and this is what blood sugar impacts the systems of your body. So it's going to impact your brain, it's going to impact your gut, your pancreas, your adipose tissue, your fat cells, your adrenal glands, your kidneys, and your liver. So that's all the systems that having diabetes or blood sugar is going to impact. So one of the keys to, and that's basically what this chart is telling us, one of the keys to reducing insulin resistance or dysglycemia, hypo or hyperinsulinemia, is fiber. Specific fiber that comes from acetate, propionate, and butyrate. Because it impacts your lungs, your liver, your pancreas, your brain, your gut, your pancreas, and your liver. So butyric acid is one of the most beneficial things to help with high blood sugar or low blood sugar because it works on membrane permeability. We have membranes in our body, 3 main membranes: our gut, our lungs, and our brain. The problem is when you get a leaky gut, leaky lung, or leaky brain, they become hyperpermeable, which means that blood sugar and insulin can get through those membranes and create inflammation. Butyric acid, resveratrol, fiber, glutathione helps to heal those membranes so things don't get through that should not get through. This is just an example of that. So this is kind of a leaky gut. So this is your intestinal membrane. LPS, lipopolysaccharides, get through because you have a leaky gut, which then trashes your liver, your muscles, your fat cells, and your hypothalamus, just because you're diabetic. This is another example of the body breaks down, especially when there's a chemical load in your body. So we start at the top with the chemical load. That impairs glutathione production. That impacts your immune system and can turn on type 1 diabetes. When you have too much of a chemical load, it impacts your glutathione. Glutathione levels are important for membrane hyperpermeability. Turns on inflammation in your brain, creates inflammation in your entire body. It reduces your NOS. Now you have cold hands and cold feet. Now you get leaky gut. Now you get leaky brain. So this is kind of a cascade of one thing after another. And then over here you get impaired biohepatic transformation. That's poor detox. So that turns on to cancer eventually, just because you got hangry or just because you got diabetes. So viruses have a lot to do. I think this is one of the only slides, or maybe the only slide, that has to do with type 1 diabetes. Type 1 diabetes, it's common to have that onset as a child. As an adult, those are the viruses that turn on type 1 diabetes. So if you're diagnosed with type 1 diabetes as an adult, for less than 10 years, we might be able to save your pancreas and turn off type 1 diabetes. If you have it as a child, I've never been able to help anybody with that, but we have had them use a ton less insulin in their insulin pumps that they have, which increases longevity by a lot. So we can help type 1 diabetes always. If you've had it for less than 10 years, adult onset, I've had pretty success fixing several of those people. So there is hope to a certain degree. Just want to put it in there. Oh, Who loves the char on food? So good, so bad for you though. It's not fair. So, talked about glycation and hemoglobin A1C. The more charred food you eat, you increase your A1C.
Wow.
Because you're eating oxidized protein, which increases the oxidation in your body, which increases your hemoglobin A1C because you're eating food that has free radical damage. It also increases your risk of cancer because of a chemical in that called acrylamide. And that's when you eat charred vegetables or meat. One of the foods, which is one of my favorite foods in the world, it's amazing. Thank you, Jesus, for French fries. French fries are one of the worst glycated end products because it has a ton of acrylamide. Because it's a quick heat of the starch, which increases glycation. French fries, I don't want to say French fries cause cancer. French fries increase your risk of cancer, which is so not fair because they're so good. So, does that mean you should never eat French fries? No, eat French fries. Eat meat with a char on it, just not every day. Smoking food also puts a char, but that's okay because it's over a long time period. It's the quick heating up of the proteins that does it, not the slow smoking of meat. So eating smoked meat is better for you than having a well done steak. So just gotta keep that in mind. It's not fair, but it's just what it is. So this, as I was doing research for this presentation, this made me mad. And I'll explain why. So this is obviously time here, and this is millions of people. So as we, and this is in the United States specifically, as we introduce more and more sugar into our diet as Americans, we see the risk of diabetes going up like this, right? So we see also that, so the trend is similar. Sugar goes up, sugar consumption by Americans goes up, diabetes goes up. But right here, diabetes goes up, but sugar production, or sugar consumption, I'm sorry, not production, but consumption, doesn't really change a whole lot from 85. So in 20 years, we don't really eat a whole lot more sugar, but diabetes goes up a lot. Well, that doesn't make sense. So people smarter than me wanted to figure out why. This is the part that makes me mad. If we look over here, glyphosate, which is Roundup, on GMO corn, soybeans. Look at this trend since 1995 to 2005. This is GMO, or genetically engineered soy and corn, and this is the rate of diabetes. I actually made it bigger so you can see it easier. This is diabetes. This is GMO food. This is diabetes. This is glyphosate. That's statistically significant. So what does that mean? We eat poison food and we have diabetes. Not okay. So if they give us poison food, we have to buy more drugs. That's bad news, guys. So the people who don't look like diabetic patients, they don't eat really bad food all the time. They eat very little carbs. How can I still have diabetes if I don't eat any carbohydrates? Because you've been poisoned from your food. Why do children have diabetes? Because they've eaten poisoned food since they were born? It's BS. And the government's doing it, and the government is allowing it to happen. The rest of the world doesn't allow genetically modified food. They do not allow glyphosate to be used in their country. Everyone in this room has glyphosate in their body at different levels. It's in the air. It's in Antarctica, a mile deep in the ice. It's in our clouds. It's a POP. It's a persistent organic phosphatase. What does that mean? Once it's created, it's never destroyed. So these toxins, they're never going to go away. Once they're created chemically, they're here forever. And where are they stored? In our body fat. Where's the most body fat in your body? Besides sometimes your belly. It's in your brain. That's type 2 diabetes. Because we eat poison food that the government won't make the food manufacturers label. So we don't have conformed consent on our food. That really aggravates me a lot. So this is why skinny people who don't look like they have diabetes have diabetes.
Wow.
This is why metformin and stuff like that doesn't work. Because they're poisoned. It's not because of their diet or their lifestyle. Well, maybe it is, but it's because they don't know they don't know that these things even exist. And if you talk to your doctor about it, they probably have no concept of this. I did a little bit, but not as much as I do now. That chart says a whole lot. So, environmental toxins, glyphosate. This is another chart over here. It's almost, you can almost overlap them on each other from glyphosate, Roundup. Roundup, you can probably say Roundup causes diabetes. All of these chemicals do. All these chemicals are everywhere in our environment. And it causes diabetes. And diabetes causes dementia. We have way more dementia in our country than the rest of the world. We have way more cancer than the rest of the world. We have way more obesity and diabetes than the rest of the world. Why? Because of this stuff here. It's everywhere that our government allows.
What about all of these, the European the countries that's over there, they have, like I know in Scandinavia, everything is
They don't
pristine.
They don't import anything from our country. No.
Especially from this country.
Especially from this country. Like I had a patient that went to Australia and their kid had goldfish crackers and they took them at customs. Like, you can't bring that in there. And they're like, why? I'm like, because there's MSG in it. They don't allow MSG in their country. That's awesome.
It is.
There's 88 names for MSG in this country. So they didn't label it MSG. It's in everything processed. And they can even bring it to the country there. Not that you should move to Australia because they're stupid about COVID, but yeah, the other countries, I think, care. I don't want to say that the government doesn't care about us, but the government and big industry want to make money on us, in my opinion. And how do we do that? If you eat poison food, you need drugs. All the rich people and companies win, and we suffer because we don't know, and our doctors don't know because they don't look at this stuff. They just look on what's the latest drug I can give you so you can lose weight. Obesogens, they breed these mice to be almost genetically the same. They fed the one on your left GMO food. They fed the one on the right non-GMO food. Fat mouse, skinny mouse. Are you a fat mouse or a skinny mouse? If you're a skinny mouse, you probably ate less GMO food. If you're a fat mouse, you probably ate more GMO food. Basically. Because all those fat cells get inflamed and it impacts your brain function quite a bit. It impacts your hormonal satiety, or however you say that word. It reduces your metabolic rate. It changes your metabolic set point. So your weight keeps going up and up and up over time, and you can't get past that. Increases your risk of obesity, all from eating GMO food. Persistent organic pollutants. Once they're created, they are just stored somewhere, typically in your body. Have anybody seen WALL-E before, the movie? My daughter loved it, and it haunts me still. But this is like in the future. So WALL-E basically is a robot that's designed to pick up trash. So basically the whole earth turns into a dumpster, and this robot's trying to clean it up. And all the people go on spaceships. And all the people, that's WALL-E, the little guy. And all the people are fat. And they just gotta hover around on their little hover scooters. He's trying to give him his trash to get rid of, and he can't even move because he's so fat. Like, is this where we're gonna be eventually?
Oh, man.
Bunch of fat people hovering around on these little hoverboards, not being able to move, totally hooked on social media. and who have no concept of reality. We're getting brainwashed by everything bad. I'm like, we laughed at it, 15 years ago when it came out, but I'm like, man, that's kind of coming true a little bit. That's not okay. So toxins, where are these toxins at? Well, everywhere. They're in. When I saw this, organic clothing.
Really?
I'm like, really? I'm like, why should I buy organic clothing? Like, that just sounds dumb. Because there's fire retardant in our clothes that outgasses and is absorbed through our skin. There's fire retardant, all the foam in our couches, in our beds, outgas, and we breathe it in all night long. It's in our pillows. Pesticides, tin cans, fluoride. What does a tube of toothpaste say? If you swallow more toothpaste than the size of a pea, call poison control. We've all swallowed more than the size of a pea. We're all toxicity. We all have fluoride toxicity, which does what? Lowers our IQ, makes us more docile. Diesel exhaust, BPA from plastics, lead, mercury, chemicals from cigarettes, exhaust. It's everywhere. You're not going to avoid it. Avoid what you can, and then we detox. We take glutathione. So these toxins are stored in our organs, our bones, and our body fat, which causes weight loss resistance. Here's something interesting. Especially in women, lead is stored in your bone. I don't know why, it just seems to be. So as women get more and more osteoporotic and start losing their bone mass, their lead levels go through the roof because the lead's coming out of their bones, and then it goes to your brain. If you lose weight really fast and you feel horrible, that's because you just opened up Pandora's box of all the toxins that were stored in your body fat. So if the guy who lost a lot of weight, like I talked about a few minutes ago, he had the worst headaches. I'm like, dude, you're opening up all toxic soup from your body fat in your circulation. And he's like, I've had the weirdest headache ever. I'm like, that's because you're poisoning your brain. So we gave him butyrate, we gave him resveratrol, we gave him curcumin, glutathione to help heal his blood-brain barrier, and all that went away. But he just had all these toxins he was losing from his body fat really quickly. And some people just have severe obesity no matter what they eat or don't eat. They just can't lose weight because your body won't allow you to lose that body fat because it's going to poison itself. So it makes you very weight loss resistant. So another thing, talking about back to obesogens, what are they in? Fructose, glycine, MSG, monosodium glutamate. It's in nicotine, it's in pharmaceutical drugs, it's in BPA, BPB, PCBs, all the things. It's in all the things. That's why Americans are fat. So they looked at environmental endocrine disruptors called diabetogens. So this basically talks about how heavy metals, chemicals in low doses of chronic exposure cause diabetes. These are the people that didn't eat like crap their whole life, but they got diabetes. So where does it start? Before you take a breath. Your genes are being altered by toxins in the environment before you're born. That's another reason why we have more autism than the rest of the world too. Because these babies' brains, the brain cells are not properly migrating from one part of the brain to the other part of the brain. And oftentimes that is hindered because of the toxins in the mom that you didn't even know about. So that's where it all starts. So preconception, as the baby's growing, during lactation, during childhood, during puberty, during adulthood, you can see that. All these things are causing endocrine disruptors throughout our entire lifespan. And that's not okay. Other places if you grew up, so when you have people that live in the country and you have your house is surrounded by a field, all of that overspray is going into your yard, you're breathing all that stuff. It increases your risk of cancer, diabetes, all these country bumpkins that have diabetes, I'm like, because they use chemicals so much. and they didn't earn diabetes. They didn't eat poor their whole life. Their body's such a chemical soup that it turns on these obesogen genes, so no matter what they eat, they're obese. And then they get dementia and Alzheimer's because of all this toxicity that they didn't know about. And a long time ago, we didn't know about it. We're just thought, hey, it's chemical, it works good. Come to find out, it's really bad for you. So glutathione is probably the most powerful antioxidant in the body, and toxic chemicals deplete your body of glutathione. Diabetic patients have reduced levels of glutathione in their blood. What does glutathione do? Detoxifies your body. Eliminates glycation. What's glycation? Elevated hemoglobin A1C. So removing toxins stops free radical damage, reduces A1C, reduces risk of dementia. Medications, a lot of medications deplete your body of glutathione. So what depletes your body of glutathione? Lack of sulfur from your diet. So stuff that makes your pee stink is high in sulfur. So eat those foods. Eating a very inflammatory diet and eating a diet low in antioxidants. Lifestyle, smoking, drinking, overeating, and medications reduce glutathione. Environmental, poor air quality. Air quality is critically important for your overall health. Radiation, industrial toxins and chemicals, and autoimmunity. So when you have depleted glutathione, it increases inflammation, reduces your chemical load, and increases your risk of diabetes. Studies indicate long-term exposure to air pollutions is positively associated with type 2 diabetes. Air pollution causes diabetes. Now, what you breathe in causes diabetes. Are you kidding me? Why even eat food? We're just gonna all get diabetes. We're all gonna be fat, floating around in space in these little hoverboard things. There's hope, though. We're getting to the hope at the end. Besides Jesus Christ. Bile, your body's ability to break down fat. When your gallbladder doesn't work, it also increases your risk of diabetes. So if you don't have a gallbladder, you have a much increased risk of diabetes. When your GI tract is dysfunctional, it doesn't work. So this study suggests that berberine and metformin show similarity in impacting your, and this talks about how your gut bacteria and short-chain fatty acids in your gut, aka leaky gut, can impact diabetes quite a bit. This talks about how your waist circumference is impacted, so your belly is impacted by toxins. This study talks about how curcumin, an anti-inflammatory herb, reduces leptin. That's the turn-off in your brain. So keeping your body deflamed reduces your risk of diabetes. So now, what labs are important to run when we're talking about this? So labs for hyperinsulinemia, we're talking about labs for insulin resistance, functional hypoglycemia. So this is what we're gonna look at. So this is what we look at when we're treating somebody who has hypoglycemia. So these are kind of all your kind of LabCorp labs. These are some of your functional medicine labs over here. These are your routine labs for insulin resistance that we're gonna run in. We're gonna look at how are your adrenals? Do you have excess glyphosate? Do you have extra Roundup in your body? Do you have heavy metals? Do you have endocrine disruptors? Do you have diabesogens? Do we do a stool test on you? So this is just this can all be normal. This can all be broken. So we gotta do both to really get a thorough evaluation of why do you have insulin resistance and type 2 diabetes. So again, this is hypoglycemia. We're looking at your adrenals. This is insulin resistance patterns. What should I take if I have diabetes? Resveratrol. Why? It's an antioxidant. What do antioxidants do? Reduce glycation. What is glycation? Elevated hemoglobin A1C. Berberine. Berberine has shown in lots and lots of studies to be as effective as metformin. It also kills gut bacteria, which stops leaky gut and leaky brain. Short-chain fatty acids, that's your fiber, that's your butyric acid. Glutathione, Gymnema sylvestri. My dad used to have type 2 diabetes, he no longer does, praise God. This desensitizes your taste buds for sugar. My dad didn't believe me, I got liquid, he drank it. Tastes horrible. He ate a piece of candy, he's like, this tastes horrible. I'm like, yeah, because you can't taste the sugar in it. So that helped him with those cravings. EPA, DHA, fish oil, fiber, and B vitamins. Where can you get these? I'm glad you asked. We have these on our website that'll be available for purchase on November 15th. So this is your resveratrol. This is your berberine. This is your methyl Bs. This is your glutathione. This is your blood sugar stability. All these things are antioxidants, deregulate blood sugar, and stop sugar cravings. This is your omega-3. This is your fiber. This is a good one this is a shake that's chocolate or caramel. I haven't had the caramel one, but the chocolate one's good. It has almost everything we just talked about in 2 scoops. This is your meal replacement shake. This is your, I'm gonna fix diabetes in a scoop, unless it's toxicity, and then it's different. And that's a whole other lecture for toxicity. So this is one of the best things to buy if you're hypoglycemia or hyperglycemia. These are things for those of you who get hangry and have low blood sugar. You gotta have your amino acids. They're super important. These are people who crash. So this is your drink that you turn to instead of caffeine. The cardiometabolic, again, this is gonna be all your things that stabilize your blood sugar. This is gonna be your fiber. And this is gonna be your adrenal support. Because when your blood sugar drops, your body produces a lot of cortisol, which is stressful, which is sympathetic and parasympathetic balance. This is gonna be your methyl B vitamin, which helps with blood sugar high and low, and gives you energy and helps to detox because of the NAC. This makes glutathione. How do you order it? You go to our website. After the talk, you hit the button, takes you to our website, and you can order these things to treat hypoglycemia and hyperglycemia. So what do we do next? That's our office. We can set up a consultation in person or over Zoom, and you can order these supplements on our website starting November 1st. So diabetes is something we can treat all over the country. This isn't something that we need to have you come in the office to treat you for. I like to see people with shining faces, but we have patients in, I can't tell you how many states, lots of states. We run your labs, we get the results, recommend supplements, tell you how to eat, tell you how to move. Socialization is very important as well for your brain function. We detox you, and you can completely eradicate or improve tremendously not only your health now, but your risk of dementia in the future. So if you don't have any questions, you're free to go.
So sorry, have an appointment.
Thanks for coming.
Thank you, buddy.
Bye, guys.
Appreciate it.
We're done at 7:30.
Yep. Anybody have any questions? Anybody pissed off?
I have one question.
Like me? About toxins and how it impacts diabetes, like statistically the same? We have a question from our Facebook Live people.
Yeah. A1C just came back at 5.7. Doctor says it's pre-diabetic. What's the most important thing I can do with that? A1C of 5.7.
Hemoglobin A1C of 5.7, so glycolated hemoglobin. That means this person has a lot of free radical damage and oxidative stress. So what do? You go to probably the middle of the presentation, and you start off with the step 1 to diabetes. And what was that? Reducing your carbs, no fruit, no artificial sweeteners.
Just berries. Berries are okay.
Berries only, yeah.
Okay.
And not lots of berries, twice as many vegetables as fruit.
Right.
Start getting more fat. Now, you don't want to shock your system and start off on keto too fast. So you're eating your vegetables first, your meat second, your carbs last. More fat than anything else. Try to exercise to your physical tolerance, but don't overtrain. From a lifestyle standpoint, just really try to eliminate all grains. That's one of the first things to do.
So what is the recommendation for fiber then, if you eliminate grains?
So you get fiber from the appropriate places. You get low glycemic index fiber.
Okay,
Where does that come from? That comes from the skin on apples.
okay,
That comes from psyllium husk.
okay.
That comes from oat fiber is kind of higher in the glycemic index, but you can still do some oatmeal. But if you are going to have oatmeal, make sure you add plenty of fat and protein to it. How do you do that? nuts and seeds.
Okay.
Throw a scoop of coconut oil in there.
Mm-hmm.
You maybe put some frozen blueberry. I like to eat oatmeal with frozen blueberries because it's hot. And you get that cold kind of pop in your mouth.
Mm-hmm.
So that's where you start. You
Okay.
start to move your body to your tolerance. You eliminate
Yeah.
grains from your diet. You start eating a little bit more fat and protein.
Mm-hmm.
If you don't want to eat animals, then don't eat animals. Just get that fat and protein from plant sources. You may need to supplement your diet if you want to try to do it more vegetarian. You just start off
I followed
slow.
a lot of what you've said
Yeah.
when I was first diagnosed 7 years ago with it. I was 11.6 in my A1C.
Wow.
And so 350 was my sugar that day. So I knew what I needed to do, and they of course put me on, metformin right away. And but right now mine's at 8.
Yeah. So
Okay,
when you're
but I've been doing intermittent fasting.
When
of
you're-
12 to
when your
14
A1C is
hours a
11,
day. Yeah.
I'd probably go on metformin because you need to get it down.
Well, I'm already on metformin.
Yeah, you need to
but
get
it's
it
gone
down
down to 8. I mean,
quicker.
it's 8 now, but it went down to 6.4 in 3 months
Six-
because I did what
Yeah.
you were talking
You went from
about.
8 to 6.4, just changing your life. Yeah.
Yeah.
We've
And-
had people in the
and
13s
it
and
shocked the
14s.
doctor. He thought it'd be an 8.
Yeah.
So I kind of kept it there. Well, now recently it's gone up to 8 because I had a lot of excess stress the last year,
Stress increases
which
your A1C
I'm recognizing what it's doing to me.
because it causes oxidative stress,
Mhm.
which increases your A1C.
And my girlfriend, like what you were talking about, glutathione, she lives in Florida.
Yeah.
She highly recommends the glutathione.
Glutathione's good. Yeah. The goal is to treat it with your lifestyle first,
Okay.
and not
Right.
take supplements because there's expense with that. There's cost. There's
Yeah.
hassle. So if we can treat
And
it,
I've lost 42 pounds in the last 7 years.
Wow, that's
doing
awesome.
What
Yep.
you said to do, but then I fall off the wagon sometimes too.
it's okay.
As you know where I work
We'll-
and all the French fries.
We'll
right?
help you get back on the wagon. So yeah, diet, nutrition, lifestyle first. When that fails, nutrition. And then when you're doing all those things and nothing works, you don't add more medication. You run a toxic profile on yourself.
Okay.
Am I just poisoned? You pull the poison out of people, and your blood
Yeah.
sugar drops. They lose a bunch of weight. So
I might have to do.
there's no one ideal program for everybody,
Mhm.
but reducing your grains. Just stop. We don't eat grains. When we were cavemen, there were no grains. We ate vegetables, meat, and we ate what we killed. That was it. We were all healthy then. It's just as we've had socialized societies now that grains are everywhere, and the grains here are what? Full of GMO food,
Yeah.
which causes diabetes, which causes dementia. No grains, increase animal fat, animal protein,
Mhm.
a lot more vegetable fat. So you're putting olive oil and avocado oil on everything. You make your broccoli, you strain it, you throw oil on top of it. Now you just made it more keto friendly.
You're talking about like olive oil.
Olive oil, avocado, coconut oil. So,
Yeah.
and then when those don't work, then you talk about what supplements can we use. Berberines, natural metformin, omega-3 to reduce inflammation in our body, which reduces glycation, which reduces your A1C, alpha-lipoic acid, resveratrol,
Yeah, I take
glutathione,
alpha
all those
lipoic
things
acid.
heal the membrane hyperpermeability.
Resveratrol.
Yep.
Yeah.
So there's really no one thing to do. There's lots of things to do. That's why working with functional medicine doctors or like myself is really the way to go. So, anybody else have any more questions?
I have one question
Yeah.
about sweeteners. I think you talked about artificial sweeteners. in
Run
the
away from those.
presentation.
Yeah,
There are so many different names for
there are
sweeteners.
so many different
Some
names for
of them are
sweeteners.
supposed to be derived from natural sugar.
Stevia is a
not.
better option,
Okay.
and that's usually a root or from the leaf.
Yeah.
And it's going to say like non-GMO. Well, of course it is. It is non-GMO. They put non-GMO on things that always are non-GMO just to sell them.
What about honey or erythritol? Like
Erythritol is a chemical,
Hmm.
so I would try to avoid that. Honey is okay, and I would recommend
It's
getting.
still high glycemic though. 'Cause
It's
I
high
was doing it
glycemic,
and
but
it
yeah,
raised my
you can
sugar.
use molasses,
Yeah.
Okay.
but you just how does your body tolerate it? And if it does raise your glucose too much, then you pair it with fat and protein, which then
Mhm.
lowers that. So you kind of have to
syrup
play
is
around with
good.
it.
I use date syrup every now and then. It's good.
What about one maple syrup
Mm-hmm.
or two this like agave stuff?
Agave is sometimes lower. Our bodies are going to metabolize everything differently based on where you are. If you have diabetes, your body's not going to metabolize anything well. if you have hypoglycemia, if your blood sugar is low, you're gonna metabolize all those things really well. So don't eat sweet things. Get used to eating things that aren't sweet. When you don't eat processed sugar for a long time, you'll be amazed how sweet fruit is. You'll be amazed how, like, a sweet potato is actually really sweet, but when you compare it to sugar or soda, it's not. Like, if I drink a sip of soda, I'm just like, oh, that's so sweet. I get a sweet potato, I'm like, man, this is sweet. It's almost decadent to me. So and I say we as Americans, we're used to having things so overly sweetened that our sweet taste buds are out of control. We just crave that sweetness. But the more you kind of pull away from that, you stop craving sweet things. Your taste buds change every 21 days. So pulling those sweets out of your diet, you just completely lose the desire to eat sweet things. And then what sweetener do I use isn't a thing because you just don't want to eat sweet stuff over time. All right, guys, well, thanks for your time. If you have any more questions, give us a call, make some appointments. And like I said, you can go to our shop November 1st, and all those supplements are going to be 15% off.